Hello, and welcome to the PlanCompare Edge for Agents webinar. We are excited to share information with you today about this exciting new digital platform for individual agents. For those of you not familiar with ConnectYourDRX, we are the market leader in Medicare shopping, quoting, enrollment, and retention solutions. We also have the most extensive distribution network in the Medicare industry and the most accurate drug pricing, which is critical to your seniors finding their best fit plans. We consider ourselves the trusted source for all things Medicare, and we thank our customers, partners, leadership, and employees for helping us make that happen. I'm Jason Schmidtkins, Director of Strategic Accounts at ConnectYourDRX, and it's my pleasure to present together with another member of our account executive team, Zach Block. Today, we will review the platform highlights of our agent solution, the differences between PlanCompare Edge for agents and PlanCompare Edge, the version that is currently available for agencies with multiple agents. Information about our carrier network, partner integrations on our platform, RetireFlo and AgencyBloc, cost of our solution, and a demo overview of the platform. We will not get to all questions today, but we invite you to follow up by sending them to pcedgedirect@connectyour.com or fill out the Contact Us form on connectyour.com. In an effort to be fully transparent about the launch of this solution, we are offering limited exclusive access to the platform for the first 500 agents for the start of AEP. For those not sure about signing up initially or who sign up after the first 500 seats are taken, there will be a waiting list and more seats will open up on January 1st, 2025. We recommend that if you are interested in getting access in time for AEP, you sign up right away when you receive the link via our e-blast. The link will also be available at the end of the month on our website at connectyour.com. And without further delay, Zach will take us through our platform highlights.
Thank you, Jason. Our platform highlights include a robust carrier network, so you have the most options for helping seniors find their best fit plans readily. This platform is a one-stop shop, meaning you have one place to manage all of your customers, your contacts, and your book of business. There's no need to go to more than one platform, as PlanCompare Edge is upline agnostic and you can continue to work with all of your trusted FMO partners. We support all Medicare plan types on the platform, including Medicare Advantage, Medicare Supplement, prescription drug plans, special need plans, and ancillary products. Of course, compliance and secure data handling are extremely important to ConnectYourDRX, so rest assured we take great measures to ensure your data is protected. We have also added the personalized URL or shopping link to our PlanCompare Edge platforms for agents and agencies. This pearl is important to helping you acquire, enroll, and retain customers. We will elaborate on this in another slide. We offer 360-degree training and support through our dedicated learning management portal with content and videos to help you get up to speed quickly on all the unique features and functionalities of this new platform. And we have key partner integrations with RetireFlo and AgencyBloc. More on that in a bit. We want to be fully transparent so you know what you are getting when you sign up for ConnectYourDRX, knowing how important it is for agents to have access to as many carriers and their plans as possible. You will have visibility into approximately 150 plus carriers for shopping and quoting, and will be able to see these carriers via the All Plans view on the platform. For the initial launch, there will be approximately 30 carriers for full enrollment capabilities, but building our carrier network is ongoing and a key part of our offering. We are really excited to offer the personalized shopping link on our PlanCompare Edge platforms starting this AEP. Your shopping link is highly effective. It's a highly effective marketing tool used to direct beneficiaries to an experience that connects you to every enrollment. This link is unique to you, so include it in your email signature or social media. Some of the benefits include encouraging the beneficiaries to self-serve, as via this link, they can shop, compare plans, and easily enroll in plans that you are licensed to sell. If a beneficiary enrolls themselves, an email confirmation is sent directly to your inbox. This link allows beneficiaries to reach out with questions, as your contact is highly visible. You can automate and update your book of business if a beneficiary creates a profile or enrolls. Note, this is only one of the unique features included in the PlanCompare Edge agent platforms, so please feel free to download the one-page flyer of platform highlights and features attached to this webinar. We realize many of you are individual agents looking for a digital solution, but we also know there are many of who have plans to grow your business and hire additional agents or currently have an upline agency with multiple agencies. There's a difference between the sites for PlanCompare Edge for agents and PlanCompare Edge for agencies. If you have multiple agents, you are probably seeking admin capabilities, which include setting up selling and admin permissions, reassigning the agent of record, and tracking an individual agent's performance. PlanCompare Edge for agencies offers you a separate site built for your agency. For those of you that fit under this category, I encourage you to fill out the Contact Us form on our website and let us know you have an agency so we can better direct you to the right solution. And now Jason will dive into the partner integrations available on our solution.
Thanks, Zach. We couldn't be more excited about our partnerships and those integrations. The first one is the RetireFlo Senior Survey, which you may already be familiar with. Agents can now be fully prepared to meet with beneficiaries before AEP or before a meeting takes place. Via this short 8-minute survey, seniors can answer questions one at a time, and agents gather drug list data, local pharmacies, doctors, and hospitals. You can also collect the scope of appointment and permission to contact. Here are just a few of the benefits that RetireFlo survey provides for agents, such as there's no username or password required, so every survey is a new opportunity to get updated information, and there are unlimited survey sends with the subscription. No more issues with seniors spelling drug names wrong or entering medications incorrectly. No more manual entry of their health data. RetireFlo keeps track of how seniors answer questions with timestamps, so if there's ever a question, an agent has a CMS-approved document supporting them against any potential grievances. Scope of appointments are in place and secure, done quickly and easily as part of the survey. We won't dive too deep into how this integration works, but this just gives you a couple of screenshots of the platform. So if you are already working on Connecture, you can go to your account overview and click on the sign up button. This will take you to the RetireFlo site to get started, and you'll follow the instructions to sign up. Note the license fee for RetireFlo is completely separate and optional from the license fee you would pay for PlanCompare Edge for Agent Solution. We're also very excited about our platform integration with AgencyBloc. At a high level, here are some benefits you can look forward to. By partnering with AgencyBloc, we offer a seamless way to sync profile data from AgencyBloc into PlanCompare Edge for agents to initiate a personalized shopping and enrollment experience. Profile data is synced bi-directionally with AgencyBloc, and that includes the name, address, and demographics. In the near future, this sync will also include drugs, pharmacies, and doctors. Real-time populating of enrollment data, such as the plan selected and more from our agent platform into AgencyBloc, will help streamline the commission management process for the agent. And always the fun part, cost. The cost of PlanCompare Edge for agents is $100 per agent per month with a minimum of a 1-year contract. There will also be options to pay quarterly or annually as well. RetireFlo and AgencyBloc are both separate licenses and are not included in the $100 per month fee. Please note also that if you are an agency and are looking at separate site instance because you have multiple agents and are in the need of admin functionality, that pricing structure is different, and our sales team will be happy to meet with you individually to discuss based on your unique needs. And now I'd like to give you a high-level overview of the PlanCompare Edge for Agents platform.
So here I am on the login screen to the PlanCompare Edge for Agents platform. Once I do log in as an agent, I will be immediately taken to my agent dashboard, where I'll be able to track any outstanding tasks I've created. So if I've sent out enrollment forms, quotes, scope of appointments, my Medicare.gov connections, or other manual tasks that I've created. I'll also be able to access reports and view our agent training materials through the learning management system here. So I do want to start by searching for a client profile. And I do like to recommend that agents search for a profile before going and creating a new one, just in case that they have already worked with that individual in the past. So here you can see we do have a match for Susie Senior here. And I've gone ahead and I've built out Susie's profile with all the information here. And again, it is important to fill out as much of this information as possible because it will pre-populate the platform throughout. And most importantly, when we get to the enrollment form, all this information will already From here, I'll be able to sign up and send out those RetireFlo surveys. I can track the scope of appointments, any notes or tasks that I've created, and then I will have a running history of any quotes or enrollments that I have completed for this beneficiary. So we do have many different ways to complete the scope of appointment. I'll show here how to do it via email. So if I go ahead and select send out that email SOA, I'll be asked to create a follow-up task to track on my agent dashboard and that client profile. You can see here that the email was sent to the client on today's date. And I'll act as if I am Susie Senior, the client here, where I will receive this email asking them to complete the scope of appointment. When they open up the scope, they'll just need to select the products they're willing to discuss. All of their information will be filled out based on the profile that we created as the agent. They attest that they read and understand the contents of the scope of appointment. Then they do a type signature, and they're all set. Now on the agent side, I'll go ahead and refresh my screen. I can see now that the SOA was completed by Susie Senior. Here are the products she's willing to discuss, and I'll enter in the agent side of the scope of appointment, check the plan that I'm going to be representing, attestation, and submit that. So now we've got a completed scope of appointment with a confirmation number, and we can view and download the PDF of that scope. Next, I'll go through the adding of preferences. So some of the health information for Susie, so we can get a personalized shopping and quoting experience. So for this case, we'll say we're interested in medical and prescription drug coverage. We have our health statuses here. So we have generally healthy, some health needs, or significant health needs with descriptions below to help determine which of those categories the client should fall into. And then we have the ability to estimate our medical costs. So based on that health status, we have default values for the potential utilization of some of these benefits, but I can always go in and update these to reflect in the quoting experience and get a more accurate estimated medical out-of-pocket cost calculation. I've already gone through and added some doctors for Susie here. You can search for a doctor or a facility. You can search for the general practice, only search for value-based care providers. We can add up to 8 and indicate which of our doctors is going to be our primary care doctor here as well. Similarly, I've already added some prescriptions here. I added Lipitor, Memantine, and Uroxetrol. Go in and add another one here. I can use our smart lookup tool. Of course, these prescriptions can already be populated if you're leveraging the RetireFlo survey. And we do also have the ability to connect to a beneficiary's MyMedicare.gov account. So we can send out an email requesting that they grant permission to share the prescription drug claims data. If they do, we can also import their prescriptions that way. Next will be our pharmacies. So we have both retail and digital pharmacies here. So if I wanted to search, I've already added Walgreens and CVS here, but I can search for the pharmacies and we'll pull up based on the zip code any of the local pharmacies that are in that service area. Mentioned we also have digital pharmacies. I've added Amazon for this experience. Then we'll continue on to the plan list page where we will be able to view the plans that are certified and licensed to sell. If we want to view all plans available, we can also add the add non-licensed plans feature here. We've got different sorting options and filters along the left-hand side that may apply for those specific clients' needs. And I can add up to 3 plans to compare side by side, where I'll get a breakdown of the costs, benefits, drug coverage here, the preferences that we have added. I am working with demo plans here today, so we're not going to show provider network statuses, but we can see only one of the 4 prescriptions are on formulary for these 3 plans, but we can view possible alternatives to see if there's an alternative prescription that is on formulary for those plans. We'll also show any optional add-on coverage that may be available for those plans, as well as the plan documents here. If I want to go ahead and dive into a specific plan details even further, I'll now have 4 tabs broken up across the top. Got a full breakdown of all the costs, benefits, preferences, and everything like that. So next we'll navigate to our prescriptions tab, where again, we will flag if there are possible alternatives. So for this Lipitor brand name drug, we can see that there are 7 Lipitor alternatives for the treatment of high cholesterol. And we can see pretty significant cost savings that we can provide this information to our client, and if it makes sense with their providers, to switch over to a generic from the brand name drug. Next, we have our health costs. So this is where we'll be able to see an estimated medical cost for the potential utilization of all these various benefits. And lastly, we have our total estimated costs. So we'll see a month-by-month breakdown of the plan premium, drug costs, health costs, and total monthly estimated cost. And we'll see the prescriptions, what phase they're in. We can click into any month. This is looking at a 1/1/2025 effective date. We can click into any month for that plan year. You can always toggle between the different pharmacies here to see how that may impact the costs as well. Lastly, I'll take us through an enrollment. So I do have the ability to send off up to 3 plans in a quote, at which point the client could self-enroll. Or if I'm ready to go ahead and add that plan to cart, I can do so here and add any optional add-on coverage that may be available for those plans as well. And then we can either send the enrollment form to the beneficiary to sign and submit via email or text. If I choose this option, I'll be able to go through and complete the enrollment form up until the point of signature and then send it off to the client. For the sake of this demo, I'll go through and complete and submit the form myself as if I was meeting with Susie in the office or at the kitchen table. So this is going to be a generic demo enrollment form. Just keep in mind that depending on the carrier, you may see some variation or different required fields for each carrier-specific enrollment form. But we've got all of Susie's personal information and contact information based on the profile that we had already created. We'll continue along next to the eligibility information. Enter in the Medicare number. We can enter in the hospital Part A and Part B effective date, requested effective date. We have our special enrollment period reasons, so grouped into different categories here where we can drop in and select which SEP reason most appropriately fits the client's needs here. They have additional prescription drug coverage. Move along to the other information. Language and accessibility, format preferences, employment information, physician lookup, and if we want to include any additional plan documents along with the application to be sent to the client. Next, we'll have our payment information. So if we want to select get a bill, electronic funds transfer, or automatic deduction. Here is our agent attestation, just acknowledging that we are appropriately licensed to sell this product. We have our statement of understanding. We have our wet signature option here. Keep in mind this platform does render to any device type. So if you or your client are working on a smartphone or a tablet, will function just the same. If they're using a touchscreen, they can use a finger or stylus to sign. Some carriers, you may see a type signature or an attestation. And lastly, we'll continue on to the review and submit page where we'll get a quick breakdown of all of those previous screens that we had completed before we go ahead and submit this application to the carrier. When I do submit that application, I'll be taken to the application confirmation page where you will be notified that the application has been submitted and is pending approval. If the carrier supports the health risk assessment, you may link out to do that here. Also got our enrollment application details, confirmation number, and we can view and download a PDF copy of that application. So now I'll just navigate back to Susie's profile, where I will see now that the profile has been a little bit more built out. We've got our note that the scope was completed. The task for the scope of appointment, we strike that through once the scope has been completed. And then now we have our enrollment history as well, where we can view more details, complete the HRA, view the confirmation number, and again, view and download a PDF copy of that. That takes us through the demo portion.
We thank you for your time today, and we anticipate the registration link for our agent solution will go out the last week in August. Please follow us on LinkedIn, Facebook, and Twitter, as we will be posting the link there in addition to on our website, connecture.com. Please fill out the Contact Us form on our website or email pcedgedirect@connecture.com to make sure we have you on the distribution list. We look forward to having you on board soon.